So in exam, you'll be given 9 minutes to prepare the station, but here it's not too much written, just one slide, which we can easily read in 1 minute. So
Yeah, 1 minute is fine.
yeah, hopefully it should be enough. 9-10 seconds are left. Right. So if you've read and understood, considering it communication skills station, kindly please begin.
Hi, my name is Dr. Mahmoud, one of the surgical doctor here. So can I confirm your relationship with the patient?
I'm the mother of the patient.
Okay, mom. So uh, your son came to us with a serious injury on his tummy.
Yes.
So he brought to us by his father. So we did a scan, what we called a first scan. Uh, we suspect the patient is having a ruptured spleen. So what we mean, the spleen is situated in the left hand side of our tummy on the upper part. So we suspect he has a injury on that one. So he has some bleeding there. So to fix that one, he need operation right now. And his father is already given consent to be operated, and the patient is already taken to theater. But I heard that you are not sure about the decision. So can you please give us go ahead with the surgery?
Do you think the father of my son was in the right state of his mind? How could he give just permission like this?
Okay, so what we got the information, your child was playing in the school and he was fallen from the swing, and then the teachers called your husband, I mean his father, and then he brought the child to us. So according to him, the patient was crying on pain, and we found some marks on the tummy. And after the scan, we showed that he got a spleen injury, hematoma. So hematoma means he has bleeding around the spleen, so that he needs operation.
When would I be able to see my son, my child?
So now we have taken to theater. If you give go ahead, so we don't have much time. You can only see after the operation.
But why do you think operation is important? Can't you just give my child medication and treat him instead?
Sorry, mom, I understand your apprehension, but the patient need immediate surgery because it's a life-threatening condition. If we don't operate the child now, he will bleed more, and then it will endanger his life. So of course he need operation.
Explain more, please, about what type of operation? Why is it important to operate on my child?
Okay, so the organ spleen I already told you that is situated on the left upper part of our tummy.
Take
So
a
that
paper
one
and
is
pen and draw and explain. Yes.
okay. Okay, so then it was ruptured.
Yes.
So that means is bleeding continuously from that organ. So we have to cut the tummy from the midline. Then we have to go inside and then fix that bleeding. We have to remove that organ. If we cannot remove that organ, then the patient will bleed continuously and it will endanger his life.
Can
So
my
we have
child
to.
die? This sounds
Yes,
really,
mom.
very complicated.
Yes, this operation is very necessary for him. If we don't go inside and if we cannot remove that organ, if we cannot stop bleeding, your child even may die. So I'm very worried about his condition. That's why we have to be in a hurry. We have to go inside and operate the child right now.
Do you think my husband was drunk? What made him give you consent like this?
Okay, so your child came with a very emergency condition. We examined him, but we couldn't see your husband. We didn't examine him. So I'm not sure. I'm not in a position to say that he is drunk or not.
What about my child?
So your child, he came as an emergency condition, so we have to look at him on the same time. Then we assess your child
How
condition.
long is my child going to stay at hospital?
Okay, so we'll take care of his condition. When his health is recovered back to normal, then we'll discharge him.
How
But
long
we'll
it will
make sure
take
that
for my child
uh,
to become normal or recover?
okay, we cannot exactly state at the time, but what we can assume, of course, when your son, after the operation, he will be normal, when he can work properly, if there is no problem, no complication from the operation, then he can be discharged home.
Why is it important to operate on my child in this situation?
So, okay,
What
ma'am,
would happen if you don't operate? Yes.
I understand your apprehension. If we don't operate, that organ I told you before is called spleen. So from there, as it's a rupture, that means is broken that organ. So it's continuously bleeding from that organ. So if we don't operate the patient, that continuously bleeding will be there. If we don't go inside, we cannot stop the bleeding with medication. So he may even die.
Do you think the surgeon who's operating on my child is expert enough?
Yes, ma'am. So Mr. Mann is one of the most experienced and he is skilled surgeon in our hospital. So I can make sure that your son in a good hand and safe hand.
Okay. Any advice you would want to give me, like after a procedure
Okay, mom.
I
So
have to
after
follow?
the procedure, as that explain what is the function, it fight against the organism. Like if after the removal of this spleen, he might develop uh, infection against some bacteria. So we have to give some vaccine and long-time antibiotic, at least 2 years, to prevent from those kind of infection.
And how would
And
yes, how would I know, or how would I make sure that my patient is being followed afterwards?
okay, so from the operation, when the patient get back to the ward, we'll take care of the patient. We have to do dressing of the tummy wound, and then we will give fluid. We'll give uh, medication for pain and even for infection. And after that, we will start this vaccination and antibiotic. And of course, we will follow him up in our OPD, outpatient department.
And you'll send a notification to the local GP as well.
And yeah, we will
Yes.
send a notification to the local GP. We'll inform him, and we will mention it in our discharge note.
Where patient will be later on followed up. This was the
Yes,
answer. Okay, I was looking for. All right. Is there any precaution I have to take care for the food that my child will eat afterwards?
okay, so when we'll discharge after a few days, maybe you cannot give normal diet, but slowly when he is recover fully, you can start normal diet and of course healthy diet. But there is no limitation for like healthy diet. You can continue.
All right. How would you conclude this conversation?
Okay, mom. So let's summarize about the condition and what I explained to you. So your son came to us with an emergency condition who has a severe tummy pain and some bruise on the tummy. Then we did a scan. It shows that he has some bleeding inside the abdomen, and we suspect from the scan he has a ruptured spleen. So now we have to take the child to theater for operation. And your husband is already given the consent. Now, if you go ahead, we will go take the patient to theater. And of course, I am here. If you have any question or anything, I will leave my number to the nurse. You can call me anytime. And now, if you have any question or any query, you can ask me. I'm happy to answer.
Yes, doctor, where do I have to give my consent?
Okay, this is a legal document. Here is the paper. Let me bring that paper for you. So it is stated that the name of the procedure, and I already explained you the possible complication and how will be done that procedure. And then you have to sign and write the date on that document.
Okay, signed. Good. Thank you.
Okay, ma'am. So thank you for understanding. We are here, all here to help you.
Thanks. Okay.